So you're facing a big decision about your treatment for proliferative diabetic retinopathy, or PDR, and you already know this is a huge one. It's more than just a medical choice, right? It feels like a life choice. It can honestly feel like you've been handed a high-stakes pop quiz you never got to study for. Well, in this explainer, we're going to try and turn that anxiety into some real clarity and help you build a plan you can actually, truly live with.
Okay, let's just dive right in. The big question always seems to be this one: laser or injections? It feels like that's the whole ballgame. But what if I told you that might not even be the most important question to ask? We're going to reframe this entire debate to help you find a plan that is built for your life, not just for a textbook or a clinical trial.
So here's the absolute heart of the matter. The real choice isn't just between a laser beam and a tiny needle. Nope, it's between a treatment plan that's durable, one that can hold up even when life gets messy and unpredictable, and a plan that's demanding, one that requires you to be incredibly consistent for it to work safely.
And what's so interesting here is that the safest treatment for you isn't always the one that looks best on paper. It's the one you can actually see through to the end, the one you can maintain. And figuring that out? Well, it starts with taking a really honest look at your life, at your calendar, not just the latest medical studies.
This right here lays out the two core philosophies beautifully. On one side, you've got the PRP laser. Think of this like building a strong foundation. You're creating a more durable, stable baseline in your eye, which usually means fewer ongoing visits once the initial treatment is done. Then on the other side, you have anti-VEGF injections. These are powerful drugs that offer amazing control, but, and it's a big but, they absolutely demand a strict, reliable schedule of appointments to keep that control.
So, how does this actually play out for you? Well, here's the thing. The single most critical factor in making this choice, it isn't on any medical chart. It's not in a blood test. It's your calendar. It's your real-world, honest-to-goodness ability to get to those appointments again and again and again.
When you walk into that clinic, your doctor is probably running through a mental checklist that looks a lot like this. Number 1, and this is the big one, can you realistically keep up with a ton of appointments? Not, oh, I hope so, but can you actually, practically do it? 2, is there swelling, what we call diabetic macular edema or DME, that's hitting your sharp central vision? And 3, just how aggressive is your PDR right now? The answers to these questions really guide the whole conversation.
This quote, this gets right to the heart of it. Let me tell you about a patient we'll call Maya. She chose injections. She had the best intentions. She was going to make every single appointment. But then, life happened. Childcare fell through, her work schedule went haywire, she missed one visit, and then another. Her story just shows how logistics, how your calendar, becomes a medical reality. Your ability to show up literally changes how much risk you're facing.
Let's make this really, really tangible. 12. Just look at that number. That's a potential number of retina-related visits. We're talking checkups, imaging, the actual treatments that you might have in just 6 months on a typical injection plan. So when you see that number, you have to ask yourself, honestly, does my life have room for that right now?
Okay, now let's talk about the vision trade-offs, because this isn't just about reading letters on a chart in a perfectly lit room. This is about how you actually see and function out there in the real world every single day.
With a PRP laser, one of the main trade-offs can be some changes to your peripheral, your side vision. And this is what that can actually feel like. It's not about going blind on the sides, it's more subtle than that. It's that split second of hesitation before stepping off a curb. It's feeling like you need to be a little extra careful on dimly lit stairs. Or maybe just noticing that headlights at night seem to bloom a bit more than they used to.
And here's the other side of that coin. While your side vision is absolutely important, your central vision, well, that's what we use for the absolutely critical tasks of daily life. It's how you read the faces of the people you love, it's how you work on a computer screen, and maybe most importantly, it's how you read your medication labels correctly and stay safe.
This is exactly why DME is such a game changer in this whole discussion. If you have this swelling, this edema, right in the center of your vision, the macula, the whole priority can shift. Protecting that sharp, detailed central vision becomes job number 1, which is why injections are so often the go-to treatment when DME is part of the picture. Okay, this brings us to a really, really important idea. The best treatment plans, they're not fragile. They're not just built for a perfect world where you make every single appointment on time. No, the best plans are resilient. They have a backup. They have a fallback plan built right in. And this is where a hybrid strategy often comes into play. It's what a lot of clinics do in the real world, and it's pretty smart. The idea is you use those powerful, fast-acting injections to put out the fire, to get the disease under control quickly.
But then, once things are stable, you follow up with the PRP laser to kind of lock in that stability, creating that durable baseline that can survive a missed appointment or two. It's really about getting the best of both worlds.
So this is it. If you take one thing away from this whole explainer, let it be this question. This is the single most important, most empowering question you can bring to your next appointment. Just ask your doctor, point blank, if life gets in the way and I miss 2 months of appointments, what is our safest fallback plan? And asking this isn't about planning to fail, it's about planning for reality. It turns a vague hope into a concrete, resilient strategy you can both count on.
And that leaves us right here with this final thought. As you talk with your doctor, as you make this decision, just ask yourself this. Is the plan we're making built for my best intentions on my best possible day? Or is it built to survive my real, messy, unpredictable life? Because choosing the plan that's built for reality, that is the key to protecting your vision for the long run.